Okay, I'm going to answer two common questions that I get all the time. One is, should I start core pelvic PT when I am pregnant if I'm not having any pain, or do I just wait until baby's born? Two is, how early can I get started after baby is born? So first, the pregnancy question, and I'm going to answer these rather quickly. I could talk forever about these, but yes, well, of course, yes, you come to core and pelvic PT when you are pregnant, because the way that it benefits you, there are multiple benefits. One is it helps your body accommodate the adaptations that we have to make during pregnancy. Some of them are necessary, some of them are habits that our body falls into because of compensation patterns and things that happen in our body that we're not even aware of, right? So you get to learn that and understand how to support your pregnancy with good stability, good in your pelvis, in your spine, and kind of what motion, like what happens in our day-to-day life that either fosters that or works against that. And that can help prevent pain during pregnancy. It can also help set you up for better success in the postpartum period, because you're not combating a lot of adaptive changes. And also, core and pelvic health can be really good for birth prep, not because of just what I mentioned, but also just reconnecting with this area of your body that is rapidly changing. It can help you understand how to use your breath, how to use your core, how to understand what your pelvic floor is, and how to use it during birth to give you better chance of success and trusting your body during that process. The third benefit of coming while you're pregnant is you already have this knowledge. So you are going to start on this path. So then once baby is there and everything gets a little bit crazy, you will already be down this road and have the understanding and the knowledge to start reconnecting with your body and knowing how different positions and motions and breathing patterns and all the things can affect your healing and can affect your body's recovery of that inner deep core pelvic floor, so we don't fall into these compensation patterns. So question number two, of course, during pregnancy, there are other benefits of well. We keep you balanced. We keep your pelvis in line, your body strong, all things. But again, I could talk about it forever. So now I'm going to move to question two. Question two, when should I start physical therapy after I have a baby? Should I wait until that 6-week clearance? Should I, when should I start? So my answer is ASAP. And there's a misconception about physical therapy that it's just exercise, right? So people think, well, I have to wait until the 6-week mark when my OB checks me and says I'm allowed to exercise, right? Which is very arbitrary. What does that mean in your body, right? So that's why you start ASAP, because it is never too early to learn about the healing process of that inner core pelvic floor, to learn what's normal, what's not, to learn your breathing patterns and how big of an impact it can have on your recovery, to learn how you're holding your baby, how you're lifting your baby, how you are going to the bathroom. All of these things make a big difference on that pressure control system and that stability system of our inner and deep core. I have a video, look it up if you haven't, the top 5 postpartum tips if you are early postpartum and you're watching this video. But that just shows you. So core and pelvic PT is more than just laying down and strengthening and doing exercises, right? It is an education and a knowledge of your body, and then you will be able to figure out how to meet your body where it's at, how you know when it's time to build. And a lot of times I see clients down the road who are, 5 years postpartum and they're running and they're still leaking a little bit of urine, right? And so then they come to find me, and we have to backpedal to this place because the concepts are there, building and connecting with that foundation and teaching your body how to use that foundation, so then all your other muscles, all of your strength can come from a strong base, is really important. So ASAP post baby. And no, it's not going to be smashing your body with exercise, so don't worry about that. But it's going to start to learn. It's about learning and reconnecting and then repatterning the system. Call me if you have any questions.